could join us today for a quick chat with Texas Tech physician Dr. Drew Payne. My name is Megan Collier with the Texas Tech University Health Sciences Center, Department of Marketing and Communications. As I said, joining us via Zoom is Dr. Drew Payne. He is the Assistant Professor of Internal Medicine. He's also the Journal Manager and Editorial Board Member for Southwest Respiratory and Critical Care Chronicles, among other things. Dr. Payne, thanks for being with us today.
Hey, thank you so much for having me.
Yeah, so tell us a little bit more about yourself and what you do with Texas Tech and the Health Sciences Center.
Well, so I kind of do three different things. I work in education, so I educate medical students and resident physicians with the internal medicine residency. I also do inpatient care at UMC, and then I do an outpatient clinic of my own and see patients in the private setting.
I think it's also important to note that you are a Panhandle guy. You've been around here for a while, a long time, so you're glad to kind of be giving back to your community, right?
Absolutely, yeah. I grew up in Amarillo, and then went to medical school in Missouri, and then finished residency here in Lubbock and have stayed here ever since. So my wife and I have been here now about 8 years. So we love West Texas and especially Lubbock. It's a great place for sure.
Awesome. So talk to us about how your practice has sort of changed in the last few weeks now that COVID-19 is on everyone's mind.
Absolutely. So I think everyone would agree that COVID has probably changed most every aspect of their working life and a lot of aspects of their social life as well. And that's true for us as well, especially in the inpatient and outpatient setting of taking care of patients. We have, for a long, long time as physicians, prided ourselves with physical exam and personal touch and communicating directly with our patients, developing that relationship. So that COVID has definitely put a whole different spin on that. We've had to move away from trying to do in-person visits and recreate the wheel of how do we do that? How do we have a relationship with our patients via video or via telephone? And so that's really been difficult. But it's been a challenge that I think in the long run will be good for all of medicine. I think West Texas is definitely a place where geographically it's hard to get to your doctor sometimes. So I think, yeah, COVID is a horrible thing, but will push us into better developing telemedicine in a lot of different ways.
Absolutely. So, you think about bedside manner and how important that is and having those conversations and that close proximity to your patients, but you do have to take a lot of safety precautions, right? What are you doing specifically in your clinics to make sure that both patient and physician and hospital and medical staff are staying safe?
Well, first of all, I think when patients that do come into the clinic, the first thing they'll notice is that we've changed the way in which they can enter the clinic. So the clinic itself is the entrances are pared down to very few entrances, and at that entrance they'll have a temperature check. Their temperature will be then documented. If they are running a fever, then there's a triaging that happens. The patient's given a mask. The patient or the person triaging then calls that specific clinic and asks what they should do next, if that patient's okay to come up, or if that patient should be sent over to the emergency room. A lot of times fever happens and it's not due to COVID, so that patient would then receive a mask and be brought up to whatever clinic they're scheduled in and be evaluated by the physician as they normally would. That fever may be from an infection on their leg or from a urinary tract infection, something that's not COVID. And then those patients would be seen and treated in their normal way. I'd also say that the patients shouldn't be surprised with the providers coming in with a mask. We've made it mandatory for all the direct patient contact personnel to wear masks. So they will have a surgical mask on. That doesn't necessarily mean that they've been tested for COVID or have any symptoms of COVID. It's just a precautionary thing that we are doing to make sure that we decrease our chance of spreading anything around.
Just from your kind of general observation, have you noticed people are receiving these changes well? Are they a little nervous about it? Just nervous in general? What's sort of the dynamic happening?
Well, I think everybody's really just nervous about the infection and the virus. I think that's a common feeling when we're faced with unknowns. I do feel that we as West Texas people and as Americans in general handle fear and change well. I think that we are very tough, and I've seen that in our patients here in West Texas. We've had to move to a procedure in which we're trying to decrease these amount of inpatient appointments. So each day the clinic is calling to either set up that virtual visit, that would be through Zoom mainly, sometimes FaceTime, or have an inpatient in-person visit. And people are very receptive to that. I think that people are hearing the shelter-in-place orders and trying to abide by those. And they understand that we're all trying to work through this together. So there is anxiety about it, but I think West Texas people are very equipped to handle things that are tough like this.
Lots of resilience here for sure. Let's talk about the respiratory symptoms associated with COVID and what people might be experiencing if they have something like COVID.
Well, so the main things that are there are fever and shortness of breath. There's a wide kind of continuum of how the severity of those symptoms. About 10 to 15% of people may have very little symptoms or no symptoms. About 70 or so percent of people probably have some more moderate symptoms, and then about 20% of people have very severe symptoms. So, there's definitely a continuum, but shortness of breath, fever, those are the main things that we're really concerned about with COVID.
All right, so the current criteria then for being tested for COVID, I think that is one of the biggest anxieties is we know what those, moderate to severe cases look like, but those mild cases, they all have kind of varying ways of showing themselves, right? So when people are wanting to be tested for COVID, what symptoms do they have to have in order to be tested? And what's that process like?
Well, so that itself has changed over the past few days as well. I think initially when we were, when the whole nation was trying to figure out what to do about testing, and we were running into shortages of testing, it was much more strict than it is currently. There was travel restrictions or travel criteria that had to be met before someone could be tested, and those have really been removed because there's so much community spread now. The major ones are still fever and shortness of breath. We are sending people to the UMC drive-through clinic. We currently at Texas Tech Physicians aren't testing. So if someone's just wanting to be tested, I would suggest one, they call the clinic and speak to their physician. And then two, they'll likely be sent over to the UMC drive-through testing, where they will undergo a rapid flu test, more than likely, and then a screening questions for COVID testing. Those screening questions have changed periodically throughout the past week or so, and they've been much more lenient with screening recently than they were to begin with. So,
and those test results really, they come back in varying degrees of time, right? Like you've got a wide time frame, right?
Right. These tests that are done with UMC drive-through screening, they have been going to a facility down in Austin to be tested, and they normally take about 24 to 48 hours to come back. And that obviously is variant with volume, how much are sent down there, and how much that clinic is screening from other testing sites as well.
So there also has been, I know in Amarillo, I know in Lubbock, in the Permian Basin, everywhere, all across the country, really, there's been a really big interest for the community to support medical communities. What can people give to you guys to really make an impact in this fight?
Well, so I would say that the biggest gift that you could offer is to help us flatten the curve initially. So stay home. Don't head out to do that social gathering that you had planned. Try to stay at home as much as you can. The next thing I would say that our personal protective equipment or PPE is really where a shortage has been over the past few weeks here. UMC and our clinic have now moved to mandatory wearing masks. So all these disposable masks, surgical masks, and these N95 masks, which I'm sure is a new vocabulary word that everybody has figured out in the last week or so. But that's really where a lot of our shortage has been. So if you have some of those masks, then donation of those masks is terrific. Also, cloth masks have been made. In fact, my mother and her Sunday school class has made some masks, and that's been terrific. It really has been. The cloth masks are not as good as the surgical masks, so but they are still better than nothing at all. They do keep you from wearing or touching your face as often. You can wear a surgical mask underneath them and the cloth mask on top to kind of make the surgical mask last longer. So those are great things. If people can have an ability to sew and have some talent in that, then that would be wonderful.
And there's more information over on the Texas Tech University Health Sciences Center webpage on how you can donate, no matter the community that you live in, for sure. Anything else that you kind of want to throw out there to all of our viewers and listeners today about COVID-19?
Yeah, the number one thing is really just, if you have symptoms or if you feel as though you're having any sort of illness, take the first step by calling your doctor. Call them. Don't go and show up at clinic. Make sure to make that communication with them and see how this best can be handled. See if we can avoid having an in-person meeting. See if we can utilize some of our telephone conversation or video meetings, and then just follow their advice. Overall, I think that the majority of people are going to be okay from this. I think that COVID is a very scary thing, and it's affecting our population in a wide array of ways. But we can get through this as a community, and I think that's the number one thing. Stay at home, call your doctor if you have any symptoms, and know at the end of this, we're still going to be West Texans and very resilient.
I love that. Okay, we've got a few more questions. We're going to wrap up on a light note. Does that sound like a plan?
That's terrific.
Okay, this is what I'm going to call the lightning round. And they're all questions about you, and you just have to answer in the first thing that pops up in your mind. Okay, ready?
I'm ready.
Okay, crunchy or smooth?
Crunchy.
Really? Interesting. Favorite ice cream flavor?
Cookies and cream, Bluebell.
Okay. Oh, specific brand. Nice. Last person you sent a text to?
Kelly Podzimny.
Nice. Favorite pro sports team?
Pro sports team, I guess I'd say the Dallas Cowboys.
Well, that's good. That's PC. Okay, now last question. You're a doc on the field for Texas Tech basketball and football.
Yes.
What player have you met that you kind of really lost your mind about, right? Well, or at the time or then afterwards, and this is what you brag to all your friends about. I was going to say fangirls, but that's not really the term that would be appropriate for you. But
I'd have to say Pat Mahomes. So sure. Pat is an extremely nice person. Always was when we got to take care of him. He's come back to a couple of football games since moving on, and he's still a pretty nice guy. So I would say of all the people, MVP, champion of a Super Bowl. So I think probably Pat Mahomes is the one.
Mahomie Nation. Dr. Payne, thank you for joining us today. We appreciate your time.
Hey, thanks for having me. I enjoyed it.